Good morning, everyone. Dr. Mindy Salvino here, a board-certified naturopathic doctor, holistic registered dental hygienist, and owner of the Pure Health Collective. Going through my inbox, I got a message wanting me to talk about bridges. So I know I've done a video on root canals, root canal toxicity. I touched on heavy metals in dentistry, and I talked about PFM crowns, so porcelain fused to metal crowns. The issue with these, I'll kind of quickly go back into it, but the issue with the PFM, in my opinion, is many people are allergic to mixed metals, nickel, and the PFM crown is a metal substructure that is not regulated. So what that's going to be made of is anything left over that the dental lab has that's sitting around. So it could be anything. It's completely unregulated. It's whatever they have on hand. It could have mercury in it. It could have nickel in it, any number of things. And then they take this substructure and they pour porcelain over it. So it is porcelain fused to metal crown. They take it'll have porcelain, and then it'll have a little margin of the metal that sticks out, and that's the part that goes under your gum when they seed a crown. If you're allergic to metal, your gum is going to be constantly inflamed, constantly bleed, and it's going to start to recede away from that crown. So that's the issue with PFM crowns. There is a company, a system called CEREC, and CEREC is 3D printed porcelain crown. So this is always my preference if someone has a choice. There's a lot lower incidence of inflammation and sensitivity to CEREC crowns. When we talk about bridges, it's going to be the exact same thing as a typical crown. So when you have a bridge, you have a tooth here, and one or two or three missing teeth, right? So they'll shave down this tooth, they'll shave down this tooth, and you'll either have a porcelain crown, a CEREC crown, put on these abutment teeth, or you'll have a PFM crown. The teeth in the middle, they're called pontics, which is just a fake tooth. The pontics are typically resin, so they are not metal most often. They're just the two PFM crowns or your CEREC crowns on the abutment teeth are the ones that you have to be concerned with heavy metals, and the center are pontic. The more teeth in the stretch, the longer the bridge is, the more likely that it will break. Just for if you bite into something really hard or chew on something hard, and you really have to keep bridges clean underneath them. So the super floss that I did a video in my flossing video, that's what I recommend to people who have bridge work. Because you can take that little pointy end, stick it right under the bridge, you can floss the abutment tooth, and you can kind of drag it along the gum line to the other abutment tooth and floss it. You will, over time, have some bone loss where the pontic teeth are, and that's normal.